Now, alrighty then. What's good, Herschel?
Tone, yo, I'm surviving, man, just like everybody else out here. I'm surviving.
Oh my God, real talk, man. Out here just trying to survive, right? But hey, man, it's good to chat with you on the podcast. The name of the podcast is Real Talk Beyond the Headlines, or just search hashtag rtbth. Herschel, what are we about, man?
Yo, we're about that real talk, man. You know, we like to keep it simple, you know, stick to the brand. We're out here talking about everything that's pertinent to us, shit that's either in our lives, our circles, you know, the successes that we're always building up on, and you know, greater things. Obviously, everything right now is coronavirus this, coronavirus that. So, I mean, you know, we can't avoid the conversation, but we're going to get into how the shit has affected us. And I'm really curious to ask you about like some of the greater like health outcomes that and shit that just we're not seeing. We like to look in the blind spots here on Real Talk Beyond the Headlines. And
Indeed.
That's what the fuck I want to know, man. So
Beyond the Headlines,
you want to kick it off or you know.
Yeah. So as Herschel said, you know, we're pretty chill with the podcast. You know, we just try to cover a lot of topics of interest to ourselves and to the public in general. I just want to say, man, we are technically a sports podcast. Like that's where we started off, you know. So I just want
ain't no
the
sports
listeners
right now though. So I guess we talk about this. You know, that's right. What's happening.
Hey man, it's blood sport out here with this coronavirus.
Facts. Yo, it's very interesting to me though because I think you and I happen to be very have a perfect niche for discussing like this particular environment right now. You with your mental health background and me with you know, the heavy public health background, and I mean the public ain't healthy right now, you know. So
ooh, damn, that's
very interesting.
Okay, well, actually, let's go ahead and talk about that background that we have. So, first of all, disclaimer: all RTBTH listeners, just understand that we are not providing any medical or behavioral health suggestions or insights for you as you progress in this
2 days. No need to water it down, man. We're about to be speaking straight facts.
Look,
the word is bond. You can take this shit to the bank.
I just don't want the APA. I just don't want the APA coming after me, man. Talk about how I was
coming for your license, bro. I feel you. I understand.
I ain't got a license to take, but anyway. But so this podcast is we're going to talk about our perspectives from the behavioral health viewpoint as it pertains to the pandemic. And as Herschel said, it's kind of relevant. It's apropos for us specifically because I am a counseling psychology PhD student. I got my undergrad degree in psychology. I got my master's degree in mental health counseling. I think, you know, I have some good insights. You know, I'm knowledgeable to a certain extent. And Herschel, what's your background like?
I have a master's in public health with a concentration in biostatistics, so I'm definitely coming with some numbers here today.
Okay.
And I am proud to announce, I think we talked about it a previous pod maybe, but I just got accepted to a epidemiologist PhD program at Georgia State. And I'm actually going to be studying infectious disease in the intersection with other toxic health outcomes, particularly drug overdoses. So right now I actually work for the CDC on the drug overdose prevention team. I look at all kinds of like morbidity and mortality numbers and shit. And we see how like all kind of syndromic surveillance, like what they're proposing for coronavirus, impacts shit. So I'm about to be even more versed in this shit after school. But right now I have a very interesting insight that I think we can discuss.
Okay. I suppose I should start calling you Young Fellowship now.
Oh, yeah. Young fellow.
Indeed. All right. So I want to start off by saying, like, I think for me, the crux of this podcast is the idea that, and, you know, I haven't seen specific numbers. I suppose it's hard to track behavioral health outcomes right now because the physical health of our nation is of the utmost priority, the biomedical health. But I feel as if there's going to be a mental health pandemic. You know, it's like a delayed response to what we're encountering right now. And I mean, this is just what I understand from mental health in general in the United States, but there's widespread mental health struggles with regard to anxiety and depression. Herschel, do you know what the second most prevalent killer of people aged 18, I think it's age 18 to 24. Do you know what it is?
Suicide?
It's suicide. So
that was a guess, bro. I should have picked something.
Oh, really?
Like way off. I mean, it was an educated guess. I was thinking about it, but I should have been like fucking clown accidents. You remember a couple years ago, all we had to worry about was clowns in the woods and shit. Now we got coronaviruses, niggas wearing masks. So
yeah,
that's what I should have said. But continue.
I mean, the point is that like people before the pandemic were dealing with mental health challenges, and what is the sort of, in my opinion, what is like one of the most common factors of mental health and the sort of disintegration of positive health, which is stress. And the pandemic is hella stressful. So I suppose today we're just trying to chat about like what this might look like for ourselves. You know, I'm coming at this from the individual level, and for the nation. And Herschel, you're coming at this from the public health level. You know?
Yeah, that's a good way to put it.
Okay, so I mean, so Herschel, you know, I'm not a PhD holder yet, but you know, I do a little research, I do a little Googles, and so the World Health Organization, they created a document where they detail the mental health and psychosocial considerations of the pandemic. I think it's important for us who are in the healthcare sort of atmosphere, but also as researchers, and to understand what the larger organizations are providing to us. But you know, some of the main considerations I've taken, I've read it in some detail. I actually brought this up in my class that I be teaching. I just want to say, don't teach undergrads, Herschel. If you can find a way to get.
I don't know, man. I'm curious.
Don't teach undergrads.
Trying to see what's
man.
up.
Undergrads are much different than they were back in 2008. I think the mental health talk is about a lot of uncertainty. We are uncertain about how just the pandemic in general is going to affect our mental health. But I feel like, you know, as a mental health provider, you know, as a training specialist, I feel pretty confident in understanding sources of anxiety, kind of how loneliness and isolation, it can exacerbate depression. And I mean, the outlook isn't good. You know, I'll just share a quote with you from the World Health Organization about considerations for the pandemic, mental health considerations. But, you know, they say minimize watching, reading, or listening to news about COVID-19 that causes you to feel anxious or distressed. Seek information only from trusted sources, and mainly so that you take practical steps to prepare your plans and protect yourself and loved ones. Protect yourself and be supportive. Assisting others in time of need can benefit both the person receiving support and the helper. I mean, without saying so much, the World Health Organization appears to be ready for another pandemic. They appear to be prepared and trying to prepare the world for another pandemic in the shape of a mental health wave.
Oh, that could be interesting. Yeah. I mean, you're mentioning stress, and one, I want to know, like, what have you been doing that's been stressful, like throughout, even though, you know, a lot of people are working from home and that could be less stress, but has there been anything in your life that like has turned up in terms of stress?
Well, I will say, you know, I think we're going to talk about social isolation and what the mental health ramifications of that is. So I'll start off by saying social isolation is challenging. But, you know, we'll elaborate on that later. I will say, you know, I had to wake up and go teach on Monday and Thursday, even though class was at 11:45, so I had to wake up that early. But then on Tuesday, I had class, and then Wednesday and Friday, I went to my practicum. All that is done. no practicum, teaching and classes online completely. So it's been a weird transition from, waking up, going out the house every day and having like kind of like a weird plate of responsibilities. It's not like I just wake up and go to work and come back. I wake up, go teach, go to the office to do research, read, whatever, come back home, maybe do a little bit more work. On Wednesday, I drive all the way to Providence, which is an hour away, or Wednesdays and Fridays for my practicum. So I had like a weird amalgam of responsibilities, and all of that just disappeared. So it feels like I'm the type of person, man, if I have a chance to sleep in, I'm going to. Like, there's no waking up early unless I need to. So I've kind of struggled with getting out of bed, trying to be productive during the day without just going back to bed, So overall, though, I feel good. Like, I truly do feel good because I'm working on writing. I'm working on reading as a PhD student. Time is of the essence. So any extra time you can get to hash out your ideas is always beneficial. But what about you, man?
Yeah, bro, I started gardening.
I
put a couple tomatoes and not yet. This is it's still not legal here yet, but that would be the move. I put a couple tomatoes, couple orange peppers outside. I got all this time on my hands, so what am I gonna do? And the real big stressor for me has been going to the grocery store. I like to eat. I've been like doing a whole bunch of different meals and cooking stuff, but because of this pandemic, it looks like a war zone every time. I've seen multiple people like damn near get into it over like what the distance of 6 feet actually looks like. People just trip out, man. And I think tensions are high. But I think on top of like those stressors, people are also, because a lot of this, aside from, the many people who have lost their jobs or have, nothing that they can do in all of this free time, that financial like instability, I can't imagine. And we're getting like stimulus packages from the government now and shit, but I don't know that that's enough. I think the biggest thing that is going to come from this is it's going to change how we just like everyday society decide, okay, are we going to have a base income when, there are instances like a third of the population can't work or cannot work from home, I should say. And I don't know, man. I've been looking at like how other nations have been responding to this pandemic, and like one of the biggest standouts is always the differences in America's healthcare system versus anywhere else. Obviously, China has had it bad, and they are most definitely lying about numbers. But what are you going to do? They're a communist country. They're hiding shit. But I've looked into several other countries and done a bit more research on like what their healthcare systems look like, and comparably to a first world country like the United States, we're fucking up. And it just kind of highlights the issues with our fucking healthcare system. Like Denmark, Germany, Taiwan, who has been knocking this out of the park as best you could. All have these universal healthcare systems, and they end up spending, even prior to this pandemic, they would spend significantly less on healthcare. Like, it's a known fact that America way overspends on all kind of stupid shit. And we're just fucking up trying to keep our insurance, who are essentially the people who end up paying for any of your medical stuff in America. It cannot be tied to our employer. When, like I said, a third of the population is out of work or some shit, or these businesses are not trying to pay health insurance. Because it is a lot of people, I understand, but the government's not stepping up. We're in some serious trouble. This is not gonna get any better.
Man, you bring up some good points, man, and I'm actually thinking about public health. Like, public health is such a like very general subject, in the sense that if it could be tracked on a large scale, it's public health. Well, if it can be tracked on a large scale and is related to human health, I'm curious, like, can we track like levels of trauma from a public health perspective? Can we track like financial distress? Can we track like insurance distress? Like, are these things that the CDC is going to be looking at?
So there are plans. That's a great question. There are plans to, build more robust surveillance systems. There are some things that are already in place. I work for it's they break it into all kind of different agencies and divisions, all kinds of stupid shit, and everything has a million different acronyms. But I work in an injury prevention division or branch, which is like an overarching thing. They all have kind of vague names. What does injury prevention mean? That could go everywhere from drug overdoses, which I'm in, to suicides, to, you hurt yourself at home falling off a ladder and all kinds of shit like that, right? In that, there is also things that you would categorize as stress monitors in these like syndromic surveillance systems. They track like domestic abuse. They track child abuse and shit like that. But the problem is we as Americans also do not like to share our health information. So it's very difficult to get that information in a timely manner. There's always some kind of roadblocks. And the tie into coronavirus is because people are so fucking panicked. They're like, yo, if somebody has coronavirus, I need to know their address. I need to know where they've been. I need to know all these things about them so that I myself can avoid it and not die. But that's not how your personal information works. Like there are politicians, and Jared Kushner is one of them, and a lot of healthcare professionals who are also kind of panicked, who are like, yo, we need to know about like this person's past medical history to a very small degree. And it's going to be a battle between invasion of privacy and like whether or not people want to survive. I'll tell you, in England, they do have, because they're not so fucking uptight as Americans, their public health information, or their health information, is more accessible. I won't say it's like super accessible where you could just look people up and be like, oh, you have cancer, you have herpes, you have this. But Americans are very private. It's a different culture. And changing culture is one of the most difficult things that a society can do, and coronavirus is about to force us to change our culture on the next level. Wow.
Okay, so I gotta sidetrack a little bit.
Okay.
Herschel, man, you did this. You're bringing up a lot of concepts related to capitalism, social structures, and the lack thereof in the United States.
Yeah.
And I don't know. It seems like to me, it sounds like we need to have a reckoning. It sounds like what you're saying. We have to have a reckoning with regard to capitalism. So thinking about insurance, one of the biggest drivers of having a capitalistic insurance system is that people can choose their insurance. They can choose their medical providers and whatnot. But that shit doesn't really hold up in a pandemic.
So here's the thing. Obama, not even to make the shit wild political, but it is. It's all like everything dealing with our health, our society, our economy, like it all kind of boils down to who the fuck is in charge. Obama tried to get a better system for us. Not a great system. Like it was still going to be broken, but like what the fuck are you going to do? You can't just overhaul everything all at once. But with the Affordable Care Act, he set up these marketplaces where people could, like, if you didn't have a job or you had a very low paying job or your job didn't provide you with health insurance, like most of American businesses, particularly the large ones who could afford to do it. Anyway, he set up these marketplaces where, okay, I'm not going to force you, the states, because, there's a separation between federal and state. States don't like when the feds tell you what to do. I'm the feds. I'm telling y'all punk ass what to do. Basically, these states were supposed to fund and provide a competitive place for people to go and shop for health insurance, and then they could afford something or get something affordable and that would meet their needs. States, these blue states, I don't know which is Republican or blue is Republican, right? I don't fucking know. It doesn't matter.
Blue is Democrat.
Okay, red. All right, these punk ass southern red states like Georgia, Mississippi, Alabama, all of these, they've defunded the shit, so the marketplace is still mad expensive. I would not, if I didn't get health insurance through my fellowship, I would not be able to afford Affordable Care Act here in Georgia.
How much is it going for? How much is it going for?
So you end up filling out a form and you essentially qualify. It puts you in different brackets based on your income, based on your age, because that's correlated to health. And a few other things, and where you live, because your zip code is also directly associated with your health. And it shouldn't be like this. We should all just get some shit. But the system's flawed, and again, capitalism. But in California, where they've decided to invest in people's health, they have a marketplace where, like, for just a couple bucks a month. I'm not a Californian, but you can actually go to their website and enter in a California zip code. Basically, fill out the form yourself, and you can see, like, oh yeah, this shit's rather affordable. But if I'm here in Georgia, it's at least a couple $100 more a month for, imagine, somebody who is already not making that much. Yeah. It's a deal breaker. And then, you're not healthy, but you're not dying. So you don't get health insurance. And then, on top of all of this, back to our punk ass pandemic, if you're, able to or not able to go to the hospital because you can't afford to have any kind of hospital bills, you can't get tested, you can't get the care that you need, you're going to die at home. And it all kind of just is a vicious cycle of our healthcare system. And coronavirus is almost a good thing because it's going to kick our ass into gear. But at the same time, money is the overarching thing. But you've mentioned, like, just basically a revolution that we need to have. And I had a particular talking point about this shit of just like overthrowing capitalism.
RTBTH.
Yes.
Let's go.
I'm gonna give it to you. So you'll hear, like, a lot of people talking about staying ahead of the curve, right?
Indeed.
Trying to flatten the curve and shit like that. Obviously, quarantining, social distance, all of this and that is staying ahead of the curve. I'm gonna give y'all some fucking game, some individual game that y'all need.
Get it.
The best way, and everybody is not going to have this, it really sucks, but it's health, wealth, and education. We gotta hustle for this paper. We gotta keep ourselves active and healthy, and we've got to fucking learn and listen to doctors and scientists and people who are a little smarter than us, who have been studying some shit.
Okay, hold on. So
what's up?
I see that as two ways. Are you saying in order to make it through, you have to stay healthy, stay wealthy, and stay educated? Or are you saying that is what the nation needs to provide in order for all of us to make it through?
Both. And I'm kind of being cutthroat about this, but everybody's not going to make it through. The way that America is going right now, shit is just about to be very tough. I've got grandparents and parents who are in the target demographic is not the right word, but who have a lot of risk factors. I do not want anything to happen to them, but at the same time, and I'm encouraging them to be more active and try to get healthier, and like just move around while they're working from home and shit like that. But at the same time, if you're 60 years old and you've been obese for the past 40 years and eating bad shit and smoking cigarettes, like, there's not very much that the American healthcare system can do for you, especially if you're broke. They can't do anything. And the other issue with our healthcare system has been, like, in the past or in the last 12 months of life for Americans, because again, we're so punk ass and unhealthy. People will go to the hospital all the time, getting rehospitalized, multiple times in a month, and they'll end up statistically, the United States has one of the highest mean per capita spending in the last 12 years of life, or 12 months of life. They also have the most in the last 3 years of life, higher than all those same countries that I mentioned before that are doing better in terms of coronavirus and healthcare in general. Denmark, Germany, Netherlands, Taiwan, England, and France have an okay program, but they still don't spend nearly as much as we do. Japan, their cultures haven't understood, like, yo, we got hella old people in this country. We need to be taking care of them. They are, quote unquote, older countries than the United States. Now, the U.S.'s fucking baby boomer population that's, all getting old and getting sick at the same time. There's not much that we can do. The system is not built to handle that kind of load. This has been on the horizon for a minute, and coronavirus was just like, yo, what's good? Spartan kick y'all off the edge.
Man, you are bringing up some really disturbing ideas, man. And like I said earlier, it's just like it's starting to really expose some of the gaps in capitalism, in the sense that we don't have a central and unified response for or system for a lot of things like healthcare. Like everyone's healthcare situation can be completely different, which means that hella people's healthcare situation could be non-existent. You know what I'm saying? We don't really have protections for low income workers. You know, it's just like there's this idea that everyone is just supposed to hustle and grind to make it. You know,
American dream. Yep.
And for the most part, you know, I think that holds true when there's not a pandemic. You know, it's crazy now. Like our most important workers outside of healthcare workers are people who have contact with people. Like I go downstairs to CVS, you know, I'm chilling, man. I'm rolling around in flip flops. Every time I go, they have like done something different. Now I went today and they're making you scan your own groceries now at CVS. So they have like a plexiglass separation now, and they all wearing face masks and gloves,
hazmat suits and shit. Yeah,
pretty much, you know. And I'm sure some of these companies, you know, I know Amazon has like increased their wages to a certain extent, and I'm sure a lot of these companies are offering some of these supposed resources, but you know, our nation is not prepared to take care of those workers. You know what I'm saying? And at this moment, they're basically our most essential workers outside of the healthcare workers. I mean, the people who are delivering groceries, shopping, like doing the actual grocery shopping, the people who are working in the grocery stores,
any kind of food association, I'd say.
The pharmacies and whatnot, the liquor stores apparently are essential. They have to be in contact with people, you know, and they don't got no like full on PPE. You know, they got. A lot of them are wearing face masks. A lot of them are wearing gloves, but that's it. Like you could definitely still get the virus.
Yeah. The other part of this is like, I don't think this shit's going away. I think it is going to become endemic, like some of these other viruses that have come around. Like, and the thing people don't realize is the flu isn't just one virus. It's a bunch of different viruses. Some of them previously have been past quote unquote coronaviruses. This is, I think, the 7th novel strain of what is determined as a coronavirus. But these shits come up all the time. Even though like we kind of laugh at how people kind of panicked over swine flu and shit like that, people still get swine flu. Like they just don't die of it. It doesn't take over the world. But I mean, just like the regular flu, people get that shit. I think this is going to eventually get to a point where hopefully herd immunity takes over. But I'm not about to live in no futuristic society where everybody is wearing masks and shit. Like what is society going to look like in 10 years, 5 years, even not even, 100 years or anything like that, where like we're super worried about, a virus and people are wearing masks in their cars and shit. And I'm like, that's not how viruses work. Like there are some barriers to this interaction. Like you can't just be, I'm going to buy up all this PPE and wear my gloves and touch everything. But then also with the same gloves where I touch everything else. And if I did pick up the coronavirus, I infected everybody. But I do agree that because there's so much unknown, I mean, we've got to do something, and people feel better from that theater of doing something like, airport security. Like TSA isn't necessarily not stopping bombs, but also a lot of that shit is for show. Let's be real.
Well, I think this is a good segue into talking about the media and the media's effects on our anxiety. I just want to say, man, I got a hot take. Okay. I also just want to forewarn our listeners to please don't drag me. That's like my greatest fear ever is to be dragged.
Drag him.
I fear being dragged, especially on Twitter, man. But no, I don't want to say that I understand the president and his feelings about the media and his infatuation with fake news. But this pandemic has helped me understand how really media can affect us and the way we think that is completely removed from the facts. I'm thinking like right around when all this stuff started, like maybe March 14th, a couple of days earlier, CNN was playing on the television how the governor of Ohio was saying that there could be 100,000 people infected with the coronavirus. I'm just like, why are you saying this? And okay, perhaps maybe there's some scientific reasoning for that. But people haven't even been exposed to social distancing yet. Like at that point, we hadn't established lockdowns or shelter in place. You know, I'm just like, why are you saying this? Like, if people don't know how this virus spreads, if people don't know to what extent it kills people, why are you saying, you know, the governor, he has to be reckoned with, but why is CNN now playing this over and over? There could be 100,000 people in the state of Ohio with coronavirus. You know, I'm just like, but you know, the media has persisted. They keep banging on the president. And again, I'm not siding with the president, Twitter, don't drag me, but they keep banging on the president for calling it the Chinese virus, the Wuhan flu, or whatever he says. And it's like, look, first of all, we know exactly what the type of person the president is by now. So for you to be mad at this is probably more to do with you, you know, not you, Herschel, but the media than it does to do with the president. But
damn, Tim,
but it's like
my ballot.
But you know, it's like the media is like, I see now that anxiety and clicks, like people have to be anxious in order to have a relationship with the media. And the media is just, you know, especially now when the only thing that they have to report is the coronavirus, the pandemic. I can see the difference between reality and the media. I can see the difference between when I go outside and I see hella people walking. There'll still be hella people walking, running, walking their dogs and stuff. A lot of people are wearing masks now, but I go outside. I got to go for a walk every now and then, man. I be going kind of crazy. But, you know, I'm like, all right, well, this is one thing that I see. Then I go on these websites, the CDC.com. I get this report from Time every day that I think is pretty level-headed. And I'm just like, man, I don't know. You guys are kind of going out of place, you know. The media sources and their way of reporting this, and I don't know. I just fear for people who fall into the grip of anxiety that the media produces. You know,
I 100% agree. I mean, I think we have known this for a long time. And I mean, yes, Trump has highlighted this about the media, but also he benefits from it. So like, it's kind of difficult it's impossible to agree with him. But yeah, man, they're a fucking business. They're an entity that's like, yo, we need to tell you some shit and tell you it in a way where you come back to us for more later. Like your blood needs to be pumping so that like you are stimulated by this news. We're gonna hit you with the flash and the beautiful people telling you shit, and you know, it's no longer just information that we need. Like, we don't need to know that somebody got shot at the fucking Waffle House at 2 a.m. on a Thursday. Like, do we really need to know that? Oh, I need to know because I need to know if my Waffle House is safe. Bro, you know whether or not your Waffle House is safe. Like, it's Waffle House. It's not safe. But that's the news. That's the local news. My parents watch hella local news. I hate it. Yeah. But that has kind of, and I think The Daily Show and Last Week Tonight and a few other shows have actually been harping on this for a while, but these conglomerates have been taken over by like one or two larger production companies, and they're just like, yo, we need the viewership, we need eyeballs. And again, you know, this is the same population we've been talking about that's susceptible to COVID, is these like 50, 60, 70, 80-year-old boomers who are like, yo, I've been watching TV for 40 years. I'm not about to not watch TV. What are you talking about?
Good point.
What do you mean? I've trusted this my whole life. There's no reason for me not to. But the change was gradual, and you know, they have trusted news sources like these. Mm-hmm. It's similar to cigarette companies where like they try to get you addicted young and stay with it. And I think the U.S. probably needs to do, I mean, it's kind of fucked up and it's not going to happen because we're built on freedom of speech and media and fucking journalism and shit like that. But the way the United States, I think it was the 80s or 90s or some shit, U.S. government sued the tobacco industry. They were like, yo, y'all lied about what the fuck you were saying about how good or bad cigarettes were for your body. Y'all lie. Y'all straight up lie. Y'all put commercials out. Y'all are killing people. People are dying because of this. In this sense, Trump is right where like motherfuckers need to look into the media. Like there's a problem here. I wish the simple solution would be like, yo, people just, you know, I guess the idea is teach our youth to seek out more than just one source. Like they need to know like, yo, look around. Don't be tunnel vision on some shit. But we as humans, you know, most of the time are not going to look for that second, third source. Most people, like on average, are not, like us, I guess. But
Yeah,
it is what it is. Like we've got to find a way, or we don't. So,
oh god,
hey man, listen,
man,
go ahead.
You've had like this weird pessimistic undertone in the whole discussion, man. What's good, bro?
Bro, I hate coronavirus so much. I hate how people are responding to it. I hate a lot of the misinformation that's come out from sources I used to trust. I saw some shit the other day on CNN whom I used to trust. I don't go there all the time, but I know you enjoy some CNN news, some PBS news, some shit like that.
You call me a CNN junkie, bro?
Bro, I don't know, man. But I think you also staying informed on what's being said is important. But I saw on their website, Sanjay Gupta was like, yo, you need to be wiping down your groceries and shit. And I was like, I mean, maybe, but also, like, is that the best use of our time here? Like, what's happening? Yeah. Like, yes, we should limit our interaction with people, but this virus can survive on surfaces for a little while. But this man is out here wiping down fucking cardboard boxes and cans of vegetables where, like, you're not ingesting that, and you probably aren't going to ingest all of it right then immediately. You should already, of course, wash your produce and your vegetables and your fruit and shit like that before you eat it. But what the fuck are you doing bringing bleach and other, like, disinfectant cleaners near your food? And that was on CNN. But at the same time, I get that people are concerned. They're trying to give any kind of information to, lessen panic. But I myself, I just try to think further on that. I'm not telling people not to wash their groceries, but I can also tell you it's not about to stop coronavirus. Like, either you got it on your hands or you didn't at that point. Like, this is not. Right? We should really start to think about this. I mean, it's too soon because, again, we're still in the outbreak. That's why I'm pessimistic. I wish we could just be past it. I wish we could be on to the next thing. The way we are about the flu, like, somebody's sick. And, of course, again, corporate America, if somebody's sick, they should stay home. But in corporate America, they don't. Like, you still might come into office with a sniffle or some shit. But now people are going to be like, no, you don't. Until, 100 years from now, when people are like, I still need you for a couple of hours here. And then we got another stupid shit on our hands, Yeah. But eventually we're going to have to treat this like we do the flu and avoid others. And Asians or Chinese people have been wearing masks for a little while now since SARS and the original there was another disease that came out of China a while ago where, and I think a lot of it also has to do with their pollution in the air, but like that's a part of their society. And I mean, it might become a part of ours, but there are other things we need to be doing that are more important than gloves and masks.
Oh, you mean like from a systems level, as far as our preparation, just the idea that this could happen, which a lot of people have sort of been discussing, man. I was watching this YouTube video. Anthony Fauci was on 60 Minutes in 2005. And I swear, man, he said the same exact thing that he says pretty much every day now. So it's crazy times, man. Okay, I got another random side note, man. Random stuff, but I just have to say, what a time to be alive. Right?
I agree.
I mean, I've struggled. I have struggled with isolation. I've struggled with trying to be productive as a PhD student. But I just have to say, man, there's so much crazy, interesting stuff in the world. Now, the pandemic is, just incredibly interesting, not necessarily for good reasons. But, I mean, first of all, virology. Just our nation has gained like 50% increase in virology in general, in immunology, in infectious diseases. I mean, that's not a bad, there's a tiny silver lining there. I mean, I think, telehealth, I'm so amazed at how the transition, at least for mental health providers, was, I haven't done any services on telehealth. I was doing my practicum in neuropsychology. Can't really transition too well because there's a lot of stimuli that you have to interact with in person. Although I'm sure there are neuropsychologists who are doing research now to sort of improve things. But to my understanding, the transition to telehealth was seamless. There's been all types of services, and the United States government has lessened some of these HIPAA restrictions. So now people are just pulling up, what a time to be alive, man.
I mean, bro, even beyond that, though, what a time to be alive in that society was just well enough prepared to survive some shit like this. Can you imagine 10, 20 years ago, before Skype and Zoom and, all these other,
Real
interactive
talk.
capabilities were already ready? Like for businesses beyond healthcare, like, or even fucking cell phones, man. What if they couldn't call you to be like, yo, you need to stay home? Like there's a pandemic going on, or, we don't know what the fuck's happening in China. And then all of a sudden, there's a million fucking visitors from China already every year. And it just wiped us out like it has in the past when we've had like the 1918 plague, and I think there have been a couple of other different big influenza outbreaks.
Ebola in Africa. To a certain extent, I feel like the United States will handle that so much better because of the surveillance capacities. But also the technologies available to sort of maintain regular life are not as developed there. So it's closer to home than we thinking about like the 1918 pandemic, whatever. Shit's just a couple years ago.
I mean, that's the lesson. One of the lessons of this podcast, stay ready. You don't have to get ready. So, I mean,
most def. Don't act like rtbth didn't teach you something. Goddamn. All right, yo, Herschel, man, I want to share some statistics with you.
Okay.
Going back to the mental health talk, man. This website, Gallup.com. A polling organization and a robust polling organization. I mean, we can trust their results because they've been in the game for several years, I think, decades, maybe. I don't know. But anyway, so they report that in the United States, people are reporting that they can continue following social distance guidelines for as long as necessary before their physical health suffers. 68% of respondents said that. 54% said that they can continue sustaining social distancing before they experience significant financial hardship. And 48% say that they can do so before experiencing significant mental health hardship. So it seems like our nation is starting to deal with the mental health implications of COVID-19. A little bit more statistics here. People who responded to the survey say 15% said that they are already suffering significant mental health issues, while only 6% said physical health, and 9% said financial health. It seems like mental health might be probably, aside from people who are actually suffering from respiratory illness, who are on ventilators, the sort of widespread ramifications, nationwide ramifications, at least on this Gallup poll, suggest that mental health might be the most important setback right now.
I mean, I would 100% agree with that. This is really interesting to think about some of the other health outcomes due to not only COVID, the disease, but also quarantine. And I mentioned, like, I was sitting in on a meeting earlier this weekend. These different states were presenting regarding like what health outcomes they were following, some of them being domestic abuse, child abuse, and how their current syndromic surveillance systems were impacted and picking things up. My team personally, our drug overdose surveillance systems, our drug overdose visits are way the fuck down. Part of that, and that's a positive, obviously. Part of that is that, we feel that, drug use when you're overdosing, big parties, opiates, methamphetamine, stimulants, shit like that. People are not congregating, or they can't go to the club and do some shit, or, whatever. So the emergency department numbers are down. I'm not sure if deaths are down yet. I don't think there's been enough time for us to gather that data, but it's interesting to see. And I was curious if you felt like, or if you had any thoughts on, how people who are already in, pressure cooker life situations have been thrown into it, especially kids who, people who might have been in college or in high school or middle school, elementary school, whatever the fuck school. And now they're going home to, toxic homes. A lot of the drug overdoses we see are they give super sad narratives of like, oh man, this person was suicidal because this, that, this. But I was curious if you thought, there would be an uptick in that.
Oh man. So I wanted, good question. Cause I've been thinking about this, and unfortunately I gotta be pessimistic, but actually a student of mine, I guess not all undergraduates are useless, but she wrote in a paper, a response paper that I assigned. She said straight up, I feel like suicides are going to go up. It's going to be like, she kind of alluded to a suicide pandemic, basically. I don't like to suggest that, personally as a mental health professional, it's really disconcerting, anything in our field. Like, we kind of tolerate a lot, but suicide is like just completely intolerable, man. People get hospitalized for suicidal ideations,
I mean, a lot of this is self-preservation that I see, like as a society, when we react this way, whether it's COVID or, a suicide attempt or something like that, I see overwhelming response. And it almost reminds me of like the human body, the way, all right, so we're on quarantine and shit now, right? So if you were to imagine the earth as a human body, if the human body were to catch the flu, you might get a fever and try to like expel out, all the toxins and bad shit or whatever. But also a fever is really bad for the rest of your body. Like if you're at a high temperature for a long time, your other systems start to break down. I think that same thing is happening here in America. And we're as this quarantine goes on, we're seeing more of that pressure cooker of like, suicides or, other outcomes. Basically.
Yeah. And that's the thing. It's like that stuff is going to be delayed specifically because, our mental health doesn't react in a sort of like linear process as sort of, an infection would. You get infected, the viruses grow, you either expel the viruses and you fight, or you die. I hate to say it like that, but like, there's a pretty kind of a general process. And, let me know what you think from the infectious disease perspective. But with mental health, we don't know what the breaking point is going to be for some people. We don't know what the effect of stress and anxiety is going to be. I'm sure you can even go down to a genetic level. If someone experiences a certain amount of stress, it could maybe start to impact the way that their body responds. Their stress hormones can increase. That can affect various organs. Isolation, if you want to do your research, if you want to do your Googles, I don't think that you could say depression and suicide or go hand in hand. I don't think that you can say that there's a direct relationship, but there is an aspect of isolation and loneliness and sort of reduced social connection, and also like, I guess, lower levels of stimulation of actually, stimulating experiences that relate with suicide. As these things decrease, as social relationships decrease, as isolation increases, as loneliness increases, as negative perspectives and beliefs about the self increase, these things correlate with suicide. It's hard for me to believe because, I look at myself and, I'm not a perfect human. Okay. But I do have confidence in my mental health, and I've struggled, so if there are people who are on more of a shaky surface with regard to the mental health, these conditions are not good. So yeah, I'm a little pessimistic, man. I just can't see how we can come out of this without having some obviously identifiable patterns, and this is where the epidemiology comes in. This is what you probably will have to contend with, but we're going to have to be able to track the levels of suicide. And actually, you brought up something that is so crucial about self-preservation. For a lot of people, self-preservation is suicide. Suicide is self-preservation because they can't deal with the psychological turmoil anymore. They have to preserve their psychological state And unfortunately for some people, that is suicide. Yeah, man, it's kind of bleak, man, in my opinion.
Yo, to take it to a brighter topic.
All right, well, thank you.
Yo, so one of our good friend of the podcast, Amber, Dr. Amber, who is an OBGYN here in Atlanta, has actually given me some information that there is probably most likely going to be a baby boom in about 8-9 months from this quarantine.
Uh-oh.
Because, yes, there are people who are like mad isolated and stuff, but a lot of people are isolated together. And, a lot of these couples, man, they might not be walking around the neighborhood, but they're getting a workout in, if you know what I'm saying, man.
Herschel, you talking about yourself, bro. You're talking about yourself.
Not me, bro. No kids yet.
Ain't gonna be no young Herschels coming out? Young Herschel the 5th?
Not anytime soon, dog. Got to get this doctorate first, and then we will see. Well, we at least got to start it. We at least got to start it.
You know what? Honestly, that is a silver lining. I've thought about a couple silver linings, man. It's hard to they're hard to come by, but with like pollution, that's one of them. I think, there could be some positive changes with regard to the global warming situation. But yeah, I didn't think about babies, man. I mean, babies always make everything better, right? Yeah. Well, sometimes they do.
That is not true, bro. You should definitely know in mental health. I'm sure there have been some people who are like, yeah, we tried to get this anchor baby going, see if that would solve our problems. Hell nah. Well, this was divorced in 2 years. Nah, it's a wrap.
But in general, like the world in general is better off with babies, right?
I don't know, man. Some people could say that, all these damn babies from that last baby boom is the reason we got this fucking pandemic right now.
Damn.
Back it up. Yeah.
Wow. That is.
Yeah. Okay, boomers. Yeah. Y'all fucking up the planet, man.
Thinking.
I mean, first they fucked up the environment, the economy, healthcare, and then suddenly, virus come to take them out. Boomers? Maybe. I might be.
You sounding like a Gen Z, man. Gen Z hates baby boomers.
There was nothing that anybody could do about this. This is one of those fucking unpredictable, predictable, the shit's gonna happen. Like earthquakes, we know that earthquakes are gonna happen, but your job doesn't have an earthquake plan just in case some shit happens and it falls into the earth. But you still got to get paid. Like, this is one of those. It's just an event. It's a world event. And once again, what a time to be alive, to be a part of a world event. We got to see the first black president. We got to see the fucking end of the world.
Damn.
We got to see everything, dog. This is
man.
What a time.
First of all, actually, okay. Hey, we got to do this real quick, man. I got to give it up. We got to give it up, but I got to give it up specifically to you, Herschel. Happy birthday. As of April 3rd? Yeah, your birthday is April 3rd. Happy birthday, man. There's a whole lot of, I don't know if this is the proper term, dead birthdays, man, because of the coronavirus.
Don't say that. I don't think you should say dead birthdays.
Okay, well, I don't know. A lot of lost birthdays, all right?
Quarantine birthdays, bro.
Quarantine birthdays. But yo, I just got to give it up to people in our, 90s babies, people who are turning 30-ish around now. I mean, we've been through a lot, man. We've been through freaking the World Trade Center. We've been through the financial crisis, and obviously everyone older than us has been through this, but we've been through this shit in our formative years, and now we're going through the coronavirus, man. So I just got to say, man, all of y'all Gen Yers, millennials, man, keep holding it down, I guess.
Yep. I remember a time before Google with my old ass.
That was quite a time. Shit is
crazy
ago,
out here, man.
Okay, Herschel, man, let me ask you a question. So we've been talking about the mental health ramifications. We've also talked about economic stress. Do you think that, some have argued, probably some of these red state governors have argued that social distancing is going to hurt us way more than the coronavirus,
Well, did you have more?
I mean, just the general kind of response to the pandemic. So we have social distancing, but we also have this these economic reparations, basically.
I would almost say I would agree with that. Okay,
some people are arguing that down the line we're going to suffer some significant inflation when we got a $2.2 trillion stimulus package.
Hell yeah!
And unemployment is going wild right now. So, and all of this is because of social distancing. So, do you feel as if maybe in a weird, bizarro world, we shouldn't have done the social distancing?
Again, to go back to being pessimistic myself, yes, I do think that. Yeah, we've kind of set ourselves into a position where we almost can't recover in how we bankrupted our country. Yeah, man, honestly, it is really callous to kind of think about it like this, but I've heard multiple people be like, yo, maybe we should have continued working and allowing people to live and make their money so that they could at least survive something rather than put their entire lives in jeopardy versus the risk of potentially dying from this, especially when the populations are, I mean, it's not the majority of people, but it is a very large population, people, 60 plus, particularly people with respiratory diseases that are getting killed. That's still a very large population. But I mean, I don't know. I don't know what the better gamble is. The best political thing is keep everybody alive, right? But
yeah,
if you tank the economy, are you keeping everybody alive? Like there are going to be repercussions. I think every day about like different businesses that I used to frequent and stuff that are just not going to exist. Like imagine, a year or 2 years, 3 years from now, like, are you going to go to a concert where people are shoulder to shoulder breathing on everybody?
Hell yeah.
Fuck. I mean, sure. Yes, but also fun, like, man. I agree. But is the venue going to allow you to do it, or are they going to be concerned that you catch coronavirus from them and then you decide to sue? Like, there are all these people who like make their money based off of crowds. Not only just like we've seen it with these talk show hosts, these TV show hosts, like I mentioned Last Week Tonight and Daily Show earlier. They're doing their shit from home now.
Them shits be whack, man.
Yeah, a little bit.
I watch them
Last
still.
Week Tonight is cool, but
the whole home video,
it's not the same.
I
100% agree. But you also kind of see. To tangent real quick, you also kind of see who's funny and who's not. Like, who's actually good at the shit, who's making moves.
That's real.
And then,
that's real.
Like, yeah, this man, John Oliver, is a fucking professional. A lot of other people, laugh tracks, we'll see. But those jobs will stay. But, like, rappers and shit who make most of their money not off the albums and shit like that because of terrible deals, but because of people coming to the shows, who's coming to the shows? Like, yes, we say that to ourselves now, but, like, it's got to be the venue that allows it. All these restaurants that can't survive being closed for a couple of months. Yes, many restaurants are open and stuff, but a lot of them are not, or have like a skeleton crew to where there's only 5 or 6 people working. All them other people, all the waiters, bottle girls, it's a wrap. Fucking strip club, I don't know what's gonna happen. That part of society might be over. Like we might see a whole new wave of. We're already seeing it with new waves of creative businesses and how people are taking conference calls and shit to the next level. I saw somebody playing a fucking trivia game in a conference just a few minutes ago earlier today. Yeah. But shit's about to be different.
Let me ask you something from an infectious disease perspective. And, I'm not trying to like put all the burden on you to explain it. You know what I'm saying? I know that you still have a long way to go in your training, and also I know you rely on the experts even as a budding expert yourself, but so I think the issue is that if we don't do social distancing, the healthcare ramifications will be literally insurmountable. And is that actually what would have happened? Like would we have just had this like nonstop emergency respiratory illnesses where people had to be in the hospital on ventilators and respirators and whatnot? Like, is it just going to be what's happening? Like we still have a lot of deaths. I mean, at this point, I think we're at like 32,000, 35,000, something like that. Like it's still happening,
It would be more than this. It would be significantly more than this. And the thing is, It's about load. Like our healthcare systems, our hospitals, particularly like the rural ones and shit, or the ones who are not in super huge cities. Like even suburban hospitals would have gotten overwhelmed by this if fucking 100 more people in their jurisdiction went to the hospital in that same 1, 2, 3 days. That's very significant, and you multiply that by however many hospitals there are. But so for example, Grady has 440 something. They might be over 500 cases of coronavirus right now. That's 500 beds or 500 areas, because they're not even just doing beds. They're doing wherever they can put these people.
Wait, but not all those cases are going to be hospitalized.
The ones in the hospital are counted as hospitalized. But like imagine.
Okay. You said Grady. You did say Grady. Okay. Like just in general, Grady has 500 coronavirus cases in the hospital. Yeah.
So similar to the flu, like where a lot of people get it and get better, like, or you get a cold and you get it and you get better. This is sending more people than they've anticipated to the hospital. And it's killing people quickly. Like they go to the hospital and then before people figure out what's going on, it's causing, I don't know if they're blood vessels or what, but something is erupting in your lungs and you're not able to breathe and then you die. It happens very quickly. That's where a lot of this panic is coming from. Like, if you're in care, like, I'm not saying you shouldn't die in hospital care, but like that's what's been scaring these people. And it hasn't been seen before. And because people don't know when you're contagious, who's contagious. I heard about the other day, a friend of mine, and this was like some 6 degrees of separation shit. I don't know anybody directly myself, but my dad has worked with people. My friends have had friends whose wife's cousins, young person wife died, and her and her husband both had it. He didn't have any symptoms. She had symptoms. And then the next morning they were like, yeah, she died type shit. Wow. But that's the fear. That's where it's like, yeah, you can't just, resign. You can't write off a million people dying. And so to give more stats on it, like I've heard numbers of about 8% of the population will at least get this, not necessarily die. And I think in the not target demographic, the high risk community or population, it's like 30% of these older adults with respiratory diseases. 30% is a huge percent. But even at that 8%, imagine there are 300 million Americans. There's 330, maybe 340 million Americans right now. If we make it easy, 300 million. 8% of 300 million is 24 million people.
Well, 8% are going to get it.
Yeah, but so yes, I didn't finish. 8% will get it, and I personally believe everybody's going to get it eventually. It's going to be one of those, like, we just kind of pass it around, just like the flu. It just kind of happens. You avoid it. You try to get your flu shots. You do what you can, but eventually the shit might come around. But if 30% I'm sorry, those statistics are kind of poor because I can't show you on a graph of breakdowns between different age groups. But
we do graphs at rtbth. Statistical analysis.
Young visuals out here. Bro, I built this beautiful fucking code the other day I got to tell you about off the podcast. But anyway. Yeah, man, it boils down to a large number of people, no matter what the percentage is. And we can all think of people in our lives who we don't want to die. So, for politicians to just be like, nah, we're not going to shut this down. Like, at a point, they had to come to Trump and be like, bro, listen, this is it. You don't have a choice. Like, this is, like, you can fuck with the media all you want. Like, these motherfuckers right here are going to die. You probably are going to die if you don't shut this shit down. And he was like, you know what I mean? I guess I don't have a choice. And also seeing other prominent countries do it is a big warning sign. We probably could have gotten ahead of this if China had been more forthright. But I mean, they're communists. How much can we really ask from them? Like, we need to be realistic. But they did put all of us in danger. But Italy, some of these other countries that didn't do shit. England actually kind of fumbled the ball a little bit. But their healthcare system is a bit more robust than ours. They're not going to... the world is not going to end. Their economies are going to be trash. All of our economies are going to be trash, which is probably another kind of silver lining in this, because inflation is about to go crazy everywhere. We all, again, are kind of living the same financial pandemic. So, I mean, it sucks. There's not really a getting out of it. Like I said before, health, fucking wealth, and education. Like we have to get bread so that we can pass on our own knowledge and keep it moving and succeed. Like it's becoming very cutthroat, or it hasn't overtly yet, but like the shit is around the corner where like, you need to make sure you and yours succeed. We should have the mentality where everybody is capable of succeeding, but America just don't run like that. Yeah. That's where my pessimism comes in. Man,
that's so unfortunate because in some ways, yeah, you got to kind of look out for yourself and your family. And, for me, like, I feel so fortunate, man. Like, I have a good place to live. I have a car. I haven't been driving, but if I need to go somewhere, I can drive as opposed to using public transportation. Like,
are you still getting paid? Do you still get an income from the school?
Yeah, like 3 days after this shit really popped off, they were like, everyone's pay is guaranteed. I was like, no one, like, they kind of almost like were trying to like reaffirm us, like, you're getting paid, And so far everything is set for the summer. I was already supposed to be funded through next year, so presumably those funds don't. I mean, it would be kind of weird if the schools just got rid of their PhD students. So I feel pretty confident, man. And talk about job security, bro. You got like the ultimate job security, man.
Yep.
So, but the thing is, like, I was gonna say, the thing is that in order to overcome, we have to work together. But all of the systems in place from a capitalistic perspective, but also from like social distancing, we have to work separately and be very individualistic, which I just can't see is going to work out in the end, man. Like, our nation is really going to have to step it up from a social perspective, in the sense that we're going to have more social systems in place to support our citizens.
Bro, I made this joke in our group chat, but we were talking about China and like the neo-industrial revolution they've been going through, and how this pandemic has like basically put a stop to that and put their government kind of behind the eight ball, and where their people. I mean, even though the government still controls all the media that these people are seeing, like, I got to imagine at some point the people are going to be like, yo, what the fuck is up? Like, you're going to need to start providing some human rights. America is going to have to do the same, where it's like, yo, we need these basic rights here. We need health. We need, if it ends up being a base income because so many people are unemployed and stay unemployed, because what jobs are going to hire them back when you don't need more than 2 waiters, because your business isn't bringing in that many customers, or everything is to go orders, or gas stations are closing down because fewer people are driving, mechanic shops are closing down because cars aren't breaking down, like all kind of the trickle down effect of halting the economy. It's a wrap. I guess to kind of segue, another thing that I think is gonna be up next is gonna be base income, but I don't know how we get to that. I don't, and I personally don't want to. Like, we're gonna have to struggle to get through this, and I don't want to struggle. I want to flourish. I want to excel. I want me and all my niggas to excel. So that's where I say, like, we need health, we need wealth, and we need education.
Indeed, man. I hope that we do excel, man. Like I said, I feel fortunate. I don't have a job that requires me to be in front of people. The pay has been secure so far. I don't, if I need to travel, I have a car, but I can't say. I mean, I know for a fact a lot of people don't have, aren't quite as fortunate. But with regard to health, wealth, and education, I think one thing that I absolutely have to address is health inequity, wealth inequity, and education inequity. I mean, the reports are rampant at this point. The Surgeon General has commented on it. Fauci has commented on it. But the people who are suffering the most from an illness and death perspective are people who are low income. Unfortunately, in our country, income correlates heavily with race. So a lot of minority races are suffering significantly because of the pandemic and the social isolation issues, the economic issues. So that's like another layer and level of pessimism. I just got to say, man, side note, Bernie Sanders is sounding real nice right about now, man.
Yeah.
Because all of these things that he has been preaching, if they had been in place, I'm not saying it would have saved us, but it probably would have been a nice little cushion where we can actually turn off the nation for a couple months without suffering significant economic issues down the line. But I mean, I'm sure the public health discipline is heavily involved with measuring health disparities. I'm curious, man. What do you think our future is looking like as far as how this is impacting disenfranchised people and communities?
We're gonna be real fucked up. Like you mentioned, man, minorities across the board are pretty much gonna get devastated. People without any kind of wealth, who tend to be the people whose jobs are most affected here. These, CEOs and people with office jobs, people, like ourselves who, are capable of working from home are going to be quote unquote fine for the most part. But, if you go to a lot of liquor stores right now, there's going to be a lot more homeless people or just alcoholic looking people that are just kind of lingering around because they don't have anywhere else to be. They don't have anywhere else to go. They might have had a job before, but shit is left right now.
Man, I want to say something real quick. There's they don't have bodegas here in Boston, but there's a bodega-esque type spot down the street from me. And I went in there, man. They had like maybe two guys, like one of them was an owner or a manager, and they always had like one or two guys that were like working, just cooking. And I'm just like, I don't see them anymore. First of all, this bodega is like one of the few places that's open. I mean, everywhere's open, but open there you can walk in and like order something. I gotta leave, but I'm just like, where did these? And I was like, before I was like, all right, these people look like they may have been homeless before they got this job, and now they're really just like, I'm not trying to like, call anyone out or talk shit, but it felt like, by the way, that bodega is right next to a homeless shelter. There's a pretty large building. I'll have to get the name for you. One side is for men and the other side is for women. So there's a lot of, a lot of people who appeared to me to be recovering from addiction, homeless people who were kind of wandering around because that's where the shelter is. So it seemed to me like they hired some homeless people who were struggling. And now when I go, I only see the manager, one person, because he can technically handle everything. He can do all the cooking. He handles all the orders. Like, and I'm just like, damn, where are they? Where are they right now?
Yeah. And I mean, it's really sad. We're going to see, very soon, like there are going to be even more people who just kind of hit the wall where like, okay, your rent company might have granted you a month here and there, but you got your stimulus package now. So I expect my money, like people are going to start getting even more frantic. Like I think that's the biggest thing about, we keep hearing about financial anxiety and shit. It's not even coronavirus has been relatively quick compared to financial anxiety, which will linger for, potentially people's whole lives if they're working paycheck to paycheck and trying to just figure their life out. But again, I don't know that I know any countries that do a full base income. I think there have been some trial runs in Canada and a few small towns, even in America, I think a couple of places. But some of the other countries that I've mentioned, Germany has education paid for. They don't have student loans and nobody pays for college. And, I imagine like the schools vary in terms of how of the academic standing, similar to America, but they don't have that problem. We've got a lot of people who aren't equipped to do anything besides maybe work in a bodega if they didn't get the chances when they were younger and, the education that they might have needed or just, just enough focus to or attention from teachers. So I think we're also going to see, and you mentioned like the positive of, telehealthcare blowing up. Teleeducation is about to be like every single class ever is going to be 100%. Not necessarily 100%, but like there are going to be classes where people used to say, oh, no, I don't want to do online because it's more work for the teacher or, they don't know how to do the shit. Everything is going to have online components. Everything is going to be like, yo, if you are sick or if you cannot come to school, we got you still. Like they're gonna figure that shit out. So
oh my gosh,
those are all the reforms right there.
I am not feeling it, man. I got a couple hot takes, man. First of all, look, if the government wants to send me some money, I'll gladly take it. I am still trying to decide how I want to blow my stimulus. No, I'm kidding.
I'm gonna buy a laptop.
Ooh, okay. I actually don't just want to save it and spend it on travel when all this shit lifts, so I can go visit my friends.
Where you want to go?
Atlanta. Goddamn.
Oh, turn up. Let's go.
But I will say, man, look, like I said, I will take all the free money, but I just don't see how it's sustainable, man. I do not see how it's sustainable to just be handing out cash, particularly in our society, in a capitalistic society. Unless you want to start taking cash away from the people who have it, the people who are millionaires and billionaires, and but then we're no longer a capitalistic society if you start taking money from people. So
yeah, I mean those are taxes. That's part of socialism. Like we already tax everybody, we just don't tax the rich people. So yes, it would be taking money from them to fund even more of the shit that is already funded. And yes, rich people pay a lot of taxes already that help us survive. Like we wouldn't be able to do it. We wouldn't be able to pay for roads and education and all the shit that we already do. But a lot of that shit is already shitty. So, I mean, we kind of need more. The real problem is like our government is also greedy, and lobbyists and shit like that are always going to be like, yo, I need my cut first. Oh, I need you to use my company or use the scientific process or I trademarked this particular process that y'all can only use, and all kinds of just basically capitalism that hold us up. Like we're about to see in the next 5 years, China is about to be like, oh, word, we got fucked up by coronavirus. Who, me? Nah. And they're gonna fucking try. Their government hopefully is gonna try to buff up and be like, yo, we are gonna give people base income. We're gonna figure out how to keep our large ass population around, or they're gonna fail. They're either gonna flourish or they're gonna fucking burn. But I think they're too big. Man. I think there's too many billion people over there for it to truly collapse in a meaningful fashion.
Yeah, that's a good point. I don't think China will collapse, but I will say this.
I mean, Soviet Union collapsed,
but it wasn't.
They were communist.
A Cold War. Yeah, but there was a Cold War also, and they were just like overextending themselves from a militaristic perspective. They were trying to hang with the United States, and they couldn't because the United States prioritizes military spending and military power above everything else. You know, I digress. Not trying to turn this into
talk that talk. Yes,
sociopolitics. But my other hot take is, bruh, look, I do not fuck with any of this Zoom socializing. Zoom classes are fine. Teaching on, I actually use Microsoft Teams, but teaching like as the instructor has been just fine for me. People talking about they want to have Zoom happy hours and shit. I am not with it.
Bro, people are trying to socialize, man. We're basically doing that now. You and me talking like we're
recording a podcast.
Socializing.
We're spitting game to the streets.
It could be both. It could be both. I'm having fun.
Nigga, we socialize every day. We text like when we see each other in Atlanta or wherever, we socialize and we reconnect. Like it's not a thing for us. It's not really crossing any boundaries for us, whether it's online or in person, because our friendship has extended so many years. But if you're talking about, you just met some people at work and y'all want to go do happy hour, social hour, whatever on Zoom, I'm not with it, man. I'm not with it.
I feel you.
And also,
my work. Go ahead.
I'm fine with the personal, but when you talk about you want to have like a group, you want to do like a fucking a DJ battle, man. I can't, man. It's too much shit on Netflix, bro. I'm sorry.
I feel you. I most definitely watched the DJ battle between Lil Jon and T-Pain. It was incredibly entertaining, but I understand. I get where you're coming from, where like there's something missing. Like just like the those talk shows, the nighttime talk shows and shit. There's something missing. You need some kind of interaction and almost a call and response that just is missing from Zoom. But I mean, again, we adapted to Skype and AOL Instant Messenger and shit, and like what is now Zoom and all these other things that, you know, old people didn't used to know how to do, but now they've figured it out. But like kids that are young now are going to be like, oh yeah, this Zoom shit, it's nothing. everything for them is going to be virtual and normal, you know?
Bro, well, look, I'm officially becoming the old head. Because I'm going to be that person who's going to be like, look, I'm good. I'm going to try and interact with people in person as much as possible. I'm going to be the person who's like, oh, Tunde doesn't want to adapt to the technology. Well, I guess not. Because I like to see people. I like to hug people. I like to give people handshakes and shit, man. I mean, look, I'm a psychologist in training. My whole entire life, I have been infatuated by humanity. And it's not going to work for me to experience humanity over a screen. You know, I've been getting into this artificial intelligence, deep learning stuff, and I have a heuristic for you. Maybe heuristic isn't the best word, but the thing that people have to understand the most about building machine learning models is that the model is only a representation of the data and real world generalization. Is only a representation. Is not the real thing. And that is the same. That is the truth for all of this technology that we're using to socialize. It's a representation of socializing, you know, at least socializing like we knew it before in person. So I'm not itching, you know, I can still hang, you know, I'm a bit introverted in general, so I can still ride, you know, in the isolation. But if we're going to get to a point where we're permanently doing happy hour on Zoom, then, you know, I might just have to check out.
Don't do that, man. Don't do that. No, yo, I will say you.
I'm not talking about that, bro.
But so to talk about other ways I've been socializing, bro, my Call of Duty game is nice these days.
Which one do you got, man? I've been thinking about getting one.
Ended up having to get the new one, man. I got the fucking Modern Warfare. I started out playing Warzone, which was free. And I hate Battle Royale. I've gotten better at it because it was the only thing I could fucking play. Obviously, I'll play FIFA and Madden and shit like that and other you know, miscellaneous video games. But COD? And like it's been 4 or 5 years since I got into a COD, but I was like, you know what?
Yeah. Did they got double jump in that one? Do they got the double jump?
Nah. You talking about where you can run on walls and shit?
Not necessarily running on walls, man. I like things that are a little bit more removed from the actual, like, you know,
from reality.
Real life gun. Yeah. Like Black Ops 3 was great.
You want to play a Halo or a fucking Advanced Warfare, COD Advanced. I do too. But also, I mean, this scratches the shooter itch. I'll say, like, it's not perfect. I mean, what the fuck? It's virtual, just like you said.
Yeah, I've been looking for another FPS, but nothing is out right now that I really like. You know, like, I wanted to fuck with that Doom, but it's one player, and then the multiplayer is like half AI. So I don't know, man.
There's a Predator game that's coming out. They released like a free beta for like a day or two, where basically like you have a squad of 4, and then you have one person playing as the Predator, and the 4 people have to. Have you seen Predator? Have you seen the movie? First and foremost,
I haven't seen any of them,
bruh. Oh, all right. Quarantine watch list, bro. You need to watch Predator. Arnold Schwarzenegger, fucking Bill Duke, fucking Jesse Ventura, governor of Wisconsin, governor of somewhere. 2 governors are in that fucking movie.
What? There were governors back then?
No, I'm talking about Arnold Schwarzenegger and Jesse Ventura. Montana. Oh, shit. They became governors after. Yeah. A whole bunch of other superstar fucking action movie type dudes. And it's a dope, like, I mean, old school fucking action movie. Like, they don't pull punches. They lean into it. I definitely say find that one. Don't watch the new shits. Okay. Don't watch any of the recent shit, The Predator, nothing like that. Old fucking Predator. Watch that shit.
All right, man. Right,
but I digress. There was a game that they came out with where basically like you have a squad and you have the Predator and you run around, and it was social, but like I don't know, man, it wasn't a great shooter either.
It was called Predator
for you. It's the video game, and the movie also.
I mean, it's unfortunate because pretty much everything pales in comparison to COD. You know, like if you really start doing your research, like it probably. You probably end up getting COD anyway. I mean, I haven't tried any of these. I forget what they're called. Like
about Battlefield.
Nah, like the Fortnite gameplay.
Fortnite. Mm-hmm.
What's that gameplay where it's like
Battle Royale?
Yeah, I haven't tried any of those. So some of those might be straight, but Anyway, man, sorry, RTBTH listeners. We're going to get back to the realness. Actually, no, I think we can wrap it up. But I do want to ask you something, Herschel.
Okay.
Have you been having more dreams lately?
I had hella dreams. Oh, bruh. Can I tell you about my dream last night?
Indeed, man.
All right. So I've had this dream before. I've had essentially a recurring dream, I guess, where like I'm late for school or like I forgot. It's a school dream. You know, everybody has some stupid ass school dream.
Hell yeah.
This one is particularly like a high school shit. I'm 30 now. Like, why the fuck am I still having high school dreams? But
because high school goddamn traumatized all of us.
Yeah, pretty much. But I missed this assignment and then I was going to class and I can never find the fucking classroom. Eventually I find the classroom and I walk in and the shit's empty and I'm like, oh yeah, coronavirus. Everybody's at home. Why the fuck would there be anybody here? And I'm like, but I'm still panicked because I don't have my assignment or whatever. And then I look down and I lost my bag. And so I have to like search back through and fucking, it's nonsensical, but eventually I find the fucking bag, don't go back to the classroom. Nothing looks the same as what it actually would be in reality. It's all, you know, awkward and loopy dream type shit. But yeah, man, I'm dreaming. Is that common?
Well, I have a theory.
Okay.
But I feel
I'm definitely sleeping more. I'm definitely like,
well, yeah. But, you know, I mean, I don't want to get too much into the Freudian analysis of human behavior, but there is an idea that there's a subconscious, right, that we are not privy to, but which still directs a lot of our behavior and our perception of reality. And I feel as if like, well, first of all, I've been having more dreams, but that could also be like a factor of the vaping that I've been doing.
Nice.
But anyway, but it's like,
yo, shout out to weed during this pandemic that has been holding it down for everybody. Everybody needs to legalize. This is some bullshit.
Oh, that's real. That's real.
Like, people need some coping mechanisms here. If the liquor store could be open, yo, we need to be having some fucking
that would be interesting. Like a nationwide like temporary legalization. You know?
Yo, here's some drugs to deal with the stress of us tanking and bankrupting the economy. Take some weed. Here you go.
Exactly.
Yo, a weed stimulus package? If everybody just got an ounce? Yo.
Let's get it.
Yo, real talk beyond the headlines. Let's go. RTBTH.
RTBTH is hereby sponsored by weed. But actually, there's a company led by the NBA player or ex-NBA player is called Viola, and they're based in I want to say Colorado, but their whole like marketing packaging is just like really dope. It's a cannabis company, so we're hereby officially sponsored by Viola. But nah, so I was saying though, Al Harrington, he played for the Hawks, didn't he? Former NBA player. Anyway, yeah. But we don't have as much stimulation, right? We don't have as much perception of the things in the world. We're not getting into our car and having to sort of navigate the streets, navigate Google Maps. You know, we're not having to walk into an elevator and go into the office and see hella people. So it's like the necessity for perceiving the world has diminished, which allows the complex subconscious material to sort of peep its head into our conscious world. Part of that, you know, like I said, we don't have to get too deep into the Freudian analysis because
that was deep as fuck. It was great. The shit was great. Continue, please.
Yeah. Okay. But like I said, because we don't have this sort of daily stimulation from our senses, and we have to combine these senses to form a reality, right? You know, you could call that the ego, the self. You know, your ability to perceive yourself is a factor of all of these senses because we're not perceiving. In order to perceive the world at the complex level that we do as humans, we have to have a very strong sense of self. But because we're not receiving all of these complex perceptual stimuli, and we're also in an environment where we can pretty much, like, we've memorized it perfectly by now. You know, before social distancing, but now, like, your home. You've memorized your home. So you're not having to perceive the world as intensely as before. So the subconscious material starts to peep its head, and hence the dreams. That could all just be bullshit, but
whoa, that's fascinating. So, all right. So if I were to, I mean, we're kind of doing this, but like, let's say you're a hermit in a fucking cave somewhere and you just stay there for, I don't know, 10 years or however long. Would you, one, essentially dream more? And two, what would your dream, would you dream about shit that's not on that island or on that, in that cave? Like, I'm not dreaming about my house.
Yeah.
Is that what you're saying?
First of all, I don't like I can only speak for myself. I feel like I've been having more dreams. I don't know if this is true, but again, it's just the fact that you're not having to sort of like be so down to earth. Like I said, if you go drive, you have to be very, very solid in your ability to perceive what's around you. We don't have to do that. So with regard to like being on an island or a cave or whatever, I think. I don't know. I mean, I think you probably have to deal more so with like the isolation. In that situation, you don't even have the connection through Zoom or whatever. Mm-hmm. But I would also say your subconscious material is dependent on how you interact with people. So, you might just. I mean, I would say that it's more likely your subconscious and conscious just kind of like dissolves into insanity in that situation, or I mean, maybe not actual insanity, but like you probably have to do a lot of like weird psychological, mental gymnastics in order to kind of persevere in that kind of environment. So,
yo, have you ever seen Castaway?
Yeah, I was just thinking of that film.
Okay, that was what you were describing. I was like, wow, that's
Yeah, but I don't know, man. Is that based on a true story? Because he came out pretty well adjusted.
Nah.
I
don't know. I don't think so. I mean, I personally think. Well, I don't know. I guess a person could survive if they have the right tools, but also if he was out in the sun all day, sun poisoning, he wouldn't come back so well adjusted. Yeah, I agree with you there. Let's find out
if it's Castaways is a true story.
Yeah. Nope. Castaway was not based on a real life story. But there are many stories in history that are similar. So fucking myths and Hercules on the island. I don't know if that's the story, but shit like that.
Right. Well, this is Real Talk Beyond the Headlines.
Yes, sir.
I do want to say one last thing. I want to go back to the issue of health equity. Just want to make a quick shout out. I saw this on the PBS NewsHour. Pretty much, I watch that shit every day by now. Even on the weekends, man. I be watching PBS NewsHour on the weekends, man. Damn. PBS NewsHour keeps it super straight, super level. Shout out to Yamiche Alcindor. She's the one that had a little back and forth with the president. But hey, man, she comes hard in the paint. She doesn't really let shit slide, man. I gotta give it up to her. I gotta also give it up to Judy Woodruff, man. She's a host. She's like 85 and just host that shit every day, but
holding it down.
Yeah, but on the PBS NewsHour, they had a segment with a woman named Uche Blackstock, and she has a website called Advancing Health Equity. They say that they focus on healthcare and healthcare providers to help them care for a diverse patient population. And they support how healthcare organizations can support a diverse workforce. Advancing health equity is their primary mission. So even though, some of these circumstances are very bleak, it's good to see that there are organizations who have thought about these important questions. And I'm pretty sure that Dr. Blackstock has had this organization long before the coronavirus. She is a black woman. She is educated with the BA from Harvard University, educated with the MD from Harvard Medical School. So shout out to the black women leaders who are doing big things. Right now, she's at NYU in emergency medicine. But, it's just one of those silver linings, man. Her organization is based in advancing health equity, looking out for the minority populations that are disenfranchised before, during, and after the coronavirus.
Nice.
Silver lining. I still do think that hella people are going to
Yo,
Oh,
Tuna,
God.
you
Let me
trying to get
stop. Let me
hired by
stop.
her, by this lady, man? This was a great plug for her, man. But appreciate the salute, man. I always love to salute our black doctors and people excelling during,
Yeah.
tough times.
Yeah, no, I mean, I'm just thinking, it's just like, it's crazy that, first of all, the thing is that these health disparities, like I've read papers, right? These health disparities have been endemic to our nation. Every single, it's not surprising. I hate to say it, but African Americans are riddled with hypertension to a greater extent than other ethnicities. Hypertension is a risk factor for coronavirus, so these things have been long researched, and people like Dr. Uche Blackstock has dedicated a part of their professional work to address them. So it's like it's kind of twofold in the sense that I appreciate the work she's doing, but we've known this for years, for centuries probably, and we're still suffering the ramifications. Not us, meaning me, but the nation in general, and then us, meaning me, black people.
Yeah, I feel you, man. Yo, I think this was a good talk. This was cool.
Most definitely, man. This is Real Talk Beyond the Headlines. Any closing remarks, Herschel?
Nah, man. Get this bread. Stay healthy. Stay moving. And fucking teach yourself something on this quarantine. Education, man.
That's real.
Those are my 3 things.
Education, with health, wealth, education. Stay up.
Oh,
This
yeah.
is rtbth. Peace.
Peace.